Hello again, I'm Dr. Nev and I'm a licensed psychologist. This is part 2 of my 10-part series of techniques you can use to help you manage your symptoms of depression. I routinely utilize these techniques with clients in my private practice and I hope you will find them to be useful as well. If you are experiencing significant distress, please contact your local psychologist. Today we'll discuss 3 additional cognitive strategies that will challenge you to examine your self-expectations and your self-talk. The first strategy is the myth of perfection and absolute competence. So individuals who struggle with depression typically have very unrealistic and high expectations of themselves. And they sometimes say things to themselves such as, I should be perfect, I should be good at everything, I should never make any mistakes, and if I do make a mistake, it's absolutely terrible. One thing that's important to remember is that no matter how good you are in life, you can't be good at everything and you will make mistakes. And even if briefly achieved, perfection is not sustainable. I would encourage you to assume that you are not a failure just because you failed at something and try to separate yourself from your behavior. I failed, but I'm not a failure. Watch your self-talk and remember that making a mistake does not make you a fool, an idiot, a loser. It just makes you a human being because we all make mistakes. And like one of the famous quotes says, if you are not failing at something, you're probably not trying hard enough and you're probably staying in your comfort zone. It's important to reframe your mistakes as growth opportunities, and instead of beating yourself up when you make a mistake or don't do something perfectly, instead ask yourself, how can I grow from this situation and what important lesson can I actually learn? The second cognitive technique is all about self-compassion and self-forgiveness. So as we already determined, you will make a mistake at some point in life, just like I have and everybody else that you know. So then ask yourself, what is my internal dialogue when I do make a mistake? How badly do I beat myself up? And the second question you should ask yourself is, if my friend or loved one made the same mistake, would I say the same things to them that I say to myself when I make a mistake? Do I say things to them like, you're a loser, or you're dumb, or you're this, or you're that? Would you ever say that to somebody you love who made the same mistake? My guess is probably not. So what might you say to them instead? You might say something like, it will be okay, we all make mistakes, live and learn, you did the best that you could, we'll figure it out, something a little bit more kind. So what I would like you to do is say that exact thing to yourself. Show yourself the same compassion that you would show any other human being that messed up or made some type of an error. Remember that we tend to be our worst critics, but also be careful not to become your own bully and somebody who just beats yourself up unnecessarily. The third technique I wanted to discuss with you is about the guilt of saying no to other people. People who struggle with depression also tend to struggle with feelings of guilt of what they think they should do, should have done, or should not have done. And this is especially prominent when it comes to saying no to others. So I get it, it's nice to say yes, it's nice to be kind and to be helpful, but when does it become harmful to constantly say yes to people when you actually want to say no instead, but just don't know how or can't actually do it? So it becomes harmful when saying yes to others means saying no to yourself. And for example, it's any time that a last-minute request might inconvenience you and you're doing it out of obligation and not because you really want to. So again, to determine if you're genuinely doing something because you want to do it or because you feel like you have to do it, ask yourself these questions. Can I say yes to this request? Can I actually do this? Do I want to do this? Or am I just doing it out of sense of obligation? What am I giving up by saying yes? And am I afraid of what will happen if I say no? Remember that you do not need an excuse to say no. Your time is just as valuable as everybody else's, and other adults are not entitled to you saying yes to their requests. So instead of saying yes, try saying no, but thank you for asking, or I hope you're able to figure something out. Remember that your plans are just as important as anybody else's, and even if your plan for the day was just to sit on the couch and read a book, that plan is just as valid as somebody else's plan and request. We will discuss the guilt-free no a little bit more in my upcoming videos on healthy boundaries, so I will come back to this topic because it is that important. So by challenging the myths of perfection, practicing self-compassion, and releasing the guilt that comes with saying no to others, you will not only build a greater sense of self-worth, but we'll also start to experience more positive emotions. Managing symptoms of depression can be complicated and time-consuming, but by practicing these 3 simple strategies, you're one step closer to developing a healthier perspective and the ability to cope with your negative feelings. Thank you so much for watching part 2 of my 10-part series of depression management. If you found this video to be useful, I certainly hope you will check out part 3. Please subscribe if you would like YouTube to inform you the next time I upload a video. Thank you for your time and take care.